Good afternoon, and thank you for joining me today as we talk about COVID-19, the pandemic here in Erie County. Today we have 17 new cases of COVID-19 and 1 new death to report, for a total of 1,143 cumulative positive cases since March. 223 of those cases are currently active cases. 892 are recovered, and a total of 28 deaths have now been reported in Erie County. To date, we've had 19,738 negative tests. Of the cumulative cases in Erie County, 58% are female and 42% are male. The breakdown by ages goes 3% ages 0 to 4, 2% ages 5 to 9, 6% ages 10 to 18, 15% are ages 19 to 24, 37% ages 25 to 49, 19% ages 50 to 64, and 18% are individuals 65 or older. Regarding race and ethnicity, our cumulative cases, we have 57% white residents, 23% African American or Black residents, 7% are Asian, 3% are other, and 11% are unknown. Regarding Hispanic origin, 8% are Hispanic of any race, 77% are non-Hispanic, and 14% are unknown. It has been reported in the news that outbreaks have occurred at 2 long-term care facilities in Erie County. This has added significantly to our numbers. But as a reminder, the Erie County Department of Health does not provide this data. It's reported to and led by the state, and the long-term care facilities are under the jurisdiction of the Pennsylvania State Department of Health. But more information can be found at health.pa.gov on those long-term care facilities. At last week's press briefing, Dr. James Lynn, president of LECOM's Institute for Successful Aging, provided an update on the Regional Response Health Collaborative Program. Back in June, the State Department of Human Services announced a request for applications for this new program. Selected grantees were awarded collectively $175 million to perform the following functions: to provide operation, management, and administrative support to protect residents in long-term care facilities from COVID-19. Number 2, to help facilities implement best practices in infection control. Number 3, to implement contact tracing programs in facilities. Number 4, to support clinical care through on-site and telemedicine services. Number 5, to provide remote monitoring and consultation with physicians. Number 6, to enhance testing capacity for staff and residents. And lastly, to assist in identifying alternate care arrangements for hospitalized COVID-19 patients until they're considered no longer infectious and can safely return to their long-term care facility. So LECOM, through this contract, has been involved in the long-term care facility outbreaks that we have seen here in Erie County. And I want to thank them for their service, not only to Erie County, but to Northwest Pennsylvania in this particular manner. If you yourself are contacted by a contact tracer, the single most thing that you can do to help stop the spread of COVID-19 to the most vulnerable populations in our community, as well as to anyone else, is to be truly honest with the contact tracers. We need to know who you have been around. And if you get contacted because you have been someone identified as being a close contact of a positive case, we need you, of course, to quarantine for the total of 14 days, as you'll be instructed to do. By doing these things, we can all work collectively to try to stop the spread of COVID-19 to our most vulnerable, particularly in our community. And now I invite David George, the Supervisor of Environmental Health Services at Erie County Department of Health, to give us an update from the work that he and his team are doing. David?
Thank you, County Executive. Earlier this week, the Pennsylvania Department of Health, along with the Department of Education, released a guidance tool to help decision-making related to instructional models for the upcoming school year. These tools use two public health metrics, the incidence rate and the percent positivity of diagnostics for each county using a COVID-19 early warning monitoring dashboard, which can be found online. These metrics are used to determine if the levels of community transmissions are low, moderate, or substantial, and based off of these transmission levels, provide recommendations for which instruction models to utilize. For example, from July 31st through August 6th, Erie County had an incidence rate of 39 cases per 100,000 residents and a percent positivity rate of 6.2%. Both of these metrics put the community transmission level of Erie County into the moderate category, which has a recommended instruction model for blended learning or full remote learning. Substantial community transmission recommends a full remote learning model, while low community transmission recommends the in-person learning model or the blended learning model be used. Transmission rates will be updated weekly, so if the transmission rate changes from week to week, schools should wait to see the results from the following 7-day reporting period before considering a change to their instructional model. However, if a significant or widespread outbreak may require moving to a remote-based model more quickly. With this guidance being very broad and based on entire county statistics, the emergency management team, along with the Erie County Department of Health, are developing a decision-making document that can be used to help determine when an alternate form of delivering education may be warranted. This document will be more specific to individual school district needs and look at components that may affect in-person instruction. We have also started to conduct our school inspections that are specifically aimed at helping each school district implement their COVID-19 mitigation tactics. Early feedback from these inspections indicate that they have been very helpful and beneficial to assist putting into action each school district's plan. We will be continuing to collaborate with our local schools to help them in this very challenging time in order to make sure that our kids are safe while receiving their education. Thank you.
Thank you, David. And I know there's just been so many questions and concerns about schools, and I really do want to commend you and the team and really all of our schools in Erie County for working diligently together to try to provide education for our students in the safest possible way. And now I'd like to turn over to the media for questions, and we'll start today with the Erie Times News.
Hi, this is Jenny Geisler. This is my first rodeo here, but I've been asked to find out why does Twinbrook have what looks like half the COVID-19 deaths in Erie County?
Well, first of all, welcome, Jenny. We're glad to have you join us here.
Thanks.
Unfortunately, when we have an outbreak in a long-term care facility, such as we've seen at Twinbrook, and as you know, that they've been pretty open about what's going on there. We have a much more vulnerable population than we do just in the general public. And even in the general public, those who aren't living in long-term care facilities, just from my own observation, those who are more vulnerable, whether they be older or have some other medical condition that makes them compromised, they're being very cautious about what they do in public. So when COVID-19 gets into a facility, like it did to Twinbrook, it can spread rapidly. And my understanding was that the initial entrance of COVID-19, the virus, into the facility occurred from an asymptomatic person, someone who had actually tested negative a week or so before, but was asymptomatic at the time that they spread it, and obviously didn't know that they were spreading it. And that's the unfortunate thing with this terrible, sneaky dangerous virus is that we have asymptomatic people spreading it unknowingly, and therefore getting into that population.
Yes, that person, he or she would have obviously been wearing masks, gowns, face shields, all these things. It just seems so terrifying to find out that you can still spread it, even if you were negative last week.
And that's why people need to understand that this is a very, very serious virus. It, again, Melissa Lyon, the director of the health department, has said from the beginning, this is a very sneaky virus. It spreads in ways that, we hadn't seen in most other viruses, and therefore, and it's very contagious. So we all have to do our part, and the best thing we can do is mitigate the spread in our community so that we don't have other healthcare workers infected and again, be asymptomatic carriers and not know it.
Yeah.
Thank you. We'll come back for more questions, Jenny. We kind of do a round, and then we'll come back to you 2 more times, okay?
That's fine, thank you.
Sure. Jet TV.
Good afternoon, Kathy. It's Star. What are these long-term facilities doing now with these outbreaks in regards to keeping the employees safe? Are they enforcing more efforts to mitigate the spread? Are they going to do more testing for employees there? What's the new protocols now?
So the protocols have been put in place by the state, and that's why I talked about this program that LECOM is heading up here in Northwest Pennsylvania. LECOM has been in the facilities where there have been these outbreaks, and they are working directly with the facilities to improve anything that does need improving. I know, for example, an N95 mask, we've been talking about what those are from the beginning, but they should be fitted in a very specific way. So I know there was assistance going with that so that the mask is fitted in the way that gives you the best protection and gives the residents the best protection. I know that there is a number of other measures that, again, LECOM has been guiding and the state has been guiding the nursing homes to try to, again, mitigate further spread. One thing I know at Twinbrook is anyone who was not positive and they didn't believe had any exposure was actually moved temporarily to another facility, which obviously is also a wise thing to help those people not get the virus and stay healthier.
Okay, thank you.
Mm-hmm. Okay, Erie News Now.
Good afternoon. A question for you regarding contact tracers. As we see case totals tending to be in the double digits now fairly routinely, how is the county's contact tracing staff holding up? I know there was an offer of more help from the state if we needed it. Has there been any consideration of taking the state up on that offer?
Well, we were able over the past few months to bring on a number of extra contact tracers, and that's really helped to relieve that staff. I'm very grateful, though, to County Council last night, who approved funding to get moving on hiring more staffing for the Erie County Department of Health while we battle COVID-19. Not only the contact tracers, but truly everybody who works at that health department has been working very, very long hours, weekends, many, many days in a row. They are exhausted, they need relief, and they also often have to get back to their jobs that they were doing prior to COVID-19. So that will be happening, and so we are grateful to County Council for approving that. But we are doing fine on the contact tracing numbers at this point, and I will say we've had some very good things that have happened with the contact tracing. For example, the day that we had 42, which was our highest number, 18 of those 42 were actually people who were already quarantined because of the contact tracing, and then they became symptomatic and were tested. So those are 18 people that otherwise would have been out in the community and potentially spreading COVID-19 further. So that shows you just the sheer benefit of the contact tracing. In fact, the day of the 42, they were either nursing home individuals who we know are not out in the general community, the 18 people who were quarantined, and there was only 3, I believe, people who we had no contact with prior and didn't live in a long-term care facility. So that number wasn't as scary as it looked when I first heard it that morning.
And can you give me just a tentative number roughly on how many contact tracers the county does have right now? I know months ago that number was hovering around 20. Where does it stand now?
I think we're fairly similar to that number. Ethan, I don't have the exact number in front of me, but we have about the same numbers we've had. It's just, we added all these extra 18 extras, I believe, and those so we have more than 20. But those people have been able to then rotate in and out, and that gives everyone a break from what they were from having to do this 7 days a week, especially as the numbers are high. I can get that number for you, though, if you would like.
I'd be much obliged. Thank you.
Okay, we'll get that to you. Thanks. Talk Erie. Joel, are you with us?
Yes. Hi, Kathy. It's Joel Natale. I have a question actually for David George, if I mind.
Great.
I wanted to follow up on the school recommendations from the Departments of Education and Health. Erie County is in the moderate category, as you said, calling for hybrid or full online learning. But considering that, according to the latest numbers today, there are only 92 cases in school-age children 5 to 18 out of around 42,000 people that live in that population, in that demographic in Erie County. That indicates like an infection rate of 0.22%. Should the state, and are you looking at infection rates in children in addition to looking at the metrics on the entire population?
That is a possibility. The one potential reason we wouldn't do that is there might be that infection rate could be a little bit higher than what the numbers show. Children might not, it might be more prevalent in the population. They may not have been tested. So we're looking at the entire population, and then it doesn't just include students. There's a lot of faculty and staff who go to school as well. So we can't just look at that one population, 5 to 18 years old. We got to look at the entire thing because there's a lot of employees, staff at schools as well that we're also concerned about. It's the entire population, not just school-aged children.
David, do you have any idea what 92 cases for any kind of communicable disease, how does that rate in any given school year?
No, that's one of the things we're kind of working on, is to look at perhaps the absentee rate for the previous school year or the previous couple of school years, and to compare that to the absentee rate that will happen this year to see if it's greater than or less than, and based off of that number, perhaps come up with a decision on how to do your instructional learning model. If it's greater than the absentee rate from the previous years, perhaps move to that online learning or remote learning, whereas if it's the same or even lower, do that in-person learning and also that blended learning model. So they're going to have to look at previous years to see how many the absentee rates for each school year.
Thank you.
I'll just add one thing, Joel, to sort of your questioning. As David said, it's also the teachers, it's the administrators, but I think it's also the family members who are back home that the children will be going home to. So again, this virus doesn't know any boundaries, and it doesn't just stay in the school, but it travels with whoever might be the carrier. So I think that's one of the concerns also. We'll go back to Erie Times News. Jenny?
Hi, yeah. I'm going to go back to Twinbrook for a moment. They were designated a COVID-19 skilled nursing site, correct?
I'm not sure what you mean by that.
Oh, okay.
I mean, they at one point looked at just being that, but that never happened. Now with the outbreak, they have moved everyone out who is not positive or pending results of a test.
Okay. So they're operating just as a regular long-term care facility at this point, is that right?
Well, that's what they have been operating as, but of course they have an outbreak going on right now. Mm-hmm.
Yeah, right. Sorry. Thank you.
Sure, okay. Star, Jet TV?
Yes, hi. Just switching gears now. Another big decision supposed to be coming out of the Erie School Board meeting this evening after a revised plan that they're looking to vote on regarding ventilation problems in 5 school district buildings. That could be more than 11,000 students potentially moving online for weeks. Your thoughts on that?
Well, I'm going to let David speak first because he's been working directly with every school district, including the Erie School District.
Yeah, ventilation systems are important. If there's not enough airflow, the virus will stay in one place, stay in the room, and there's a potential for more spread. During our strike team visits, we're recommending that all schools get their HVAC units looked at before the start of the school year to make sure they're running properly. I know some HVAC units are a little more advanced and high tech than others, but if you don't have, that's one of the things we're looking at. If you don't have a good HVAC unit, definitely promote online learning. That's one of the key factors for an equipment at a school that if that's not functioning, we're highly recommending the remote learning.
Star, I'll just comment for a minute on that, and that this is very, very challenging. It's very challenging for the schools, the administration. It's very challenging for the parents, knowing they are going to have to help, their child on a daily basis while they're doing virtual learning. And every employer, I'm sure, is dealing with this because they've got parents who work for them. So it's a challenge all around, and I just ask our community in general to try to be as supportive as we can of the school systems, of the parents, the teachers. This is not an easy time for anyone, and I think it's particularly challenging for any person of school age and anyone dealing with the school issues in front of us, and there's no easy answer here. Erie News Now?
Okay, thank you.
Sure. Erie News Now, Ethan?
Hi, a question perhaps for both of you. In speaking with school leaders, how much does getting this guidance from the state so late in the game mess with their plans, throw a wrench into their plans when all of a sudden the state comes out in mid-August and says you'd be better off using a hybrid model? What are you hearing from administrators and from school leaders as they try to adjust to this latest guidance?
I'll let David speak to that. He's had some conversations around that. David?
The biggest word is definitely frustrating. Like you said, very late in the game, right before schools are about to open up. Many of the school superintendents are frustrated that this guidance came out earlier this week. And more guidance will probably come out in the next couple of weeks. It's just the nature of the beast. Guidance is coming out every day. It's frustrating, challenging, but we just got to roll with it, adapt to it. And it is guidance, use it to the best of our abilities. Like I said, we're going to try to develop a plan to make it more school district specific. Some schools might have to go back and look at their plan and try to adapt to it, but we've kind of stressed from the beginning that it's kind of got to be a plan that it has a lot of room for change and variables. So it's definitely challenging and frustrating, but that's the biggest problem. But that's kind of how the normal now. So going forward, hopefully the schools will look at the guidance and make the necessary changes to their plan if they have to, and get their board to vote on it and approve it. But we'll go from there.
As you talk about it being more district specific, can you explain what you mean by that? Could you take, say, a district that's a little bit further outside of the city and that doesn't have near as many cases and say, listen, this district's in a position to bring students back entirely, whereas a district which area has more cases maybe wouldn't be? Would you be looking at something that granular?
For example, for each school district, you want to identify your essential personnel, like your school nurse, your bus drivers. If you have any cases there, that's going to impact whether you can bring kids to school. So you might have to do more hybrid learning or remote learning. And then, as I mentioned, that absentee difference between previous years and this year. If you're seeing an increase in that, you might want to consider the hybrid learning, remote learning. There's going to have to be some decisions made based off numbers. And I think when used in conjunction with the state's guidance for transmission rates and percent positivity, we'll be able to develop a complete module that will give superintendents the tools that they will need to make a decision best for their specific community.
And one final one just on this topic. You're hearing of any districts that plan to bring students back entirely despite this recent round of state guidance? They say, listen, it's guidance, but we still think we're in a position to bring everybody back? Or do you think we'll see that complete transition countywide?
I think there are some schools that have complete bring students back, but they also do have an option where if they request it, that they can get virtual learning. So I think almost everyone is a slight hybrid. Some are more than others. Some are bringing more students back. Some are a mix and others are more remote. So it is kind of varied depending on the school district, but each one has their own challenges and they're tackling them to the best of their abilities.
Thanks.
I think, thank you, Ethan. And one of the things that's important to remember is that this virus is all over the county. It is not just concentrated in the city of Erie. We had a spike, obviously, which was reported quite heavily in certain areas of the city. But what we're seeing now, again, is what we've been seeing is that the virus is really all over. And a number of the positive cases that we have seen lately, if there's any trend to it, it's that we are getting a number of people who have traveled. They have taken their summer vacation somewhere outside of Erie County, and we are now seeing the results of that with some of the numbers that we're reporting. We'll go back to Talk Erie to Joel.
Yes, hi, Kathy. There's been multiple attempts to reach out to those hot zips in the city of Erie, 16503 and the surrounding zips, including this past Saturday. Thousands of mass information were again passed out. Are we seeing any evidence that these outreach efforts are starting to make a difference in stopping the spread?
We are seeing that, and we're seeing it in our numbers. You can see it even in some of our demographic numbers changing somewhat. And so, again, we're not seeing a real hot spot anywhere right now. We're seeing more of a widespread throughout Erie County with these positive numbers. So I think that the work that's been done by so many, the churches and some of the nonprofits and of course the neighborhood centers in conjunction of course with the health department has really been successful in helping to slow down that spread in a very concentrated urban area where people are much closer in contact with each other on a daily basis.
I keep on hearing reports that parties are happening. Are you hearing those reports too?
Well, parties have been happening all over, you're right. Graduation parties, wedding parties, showers, whatever gathering it might be, it's happening. And it's not just happening in one place. It's happening all over the county. And larger crowds, people not wearing masks. I cannot emphasize enough that wearing a mask is really important when you're around other people. So if you're going to have any kind of gathering, wear your mask, make sure other people are wearing it, and if they're not, I suggest that you leave and go home. So it's happening, but it's not happening just in one area. It's happening around the whole county.
Thanks.
Sure. Erie Times News? Go back to you, Jenny.
I'm good.
Okay, thank you. And how about Star Jet TV?
Yes, what is the guidance that the county is giving these local school districts throughout the county in regards to transportation or guidance for teachers that are gearing up to potentially have some students head back to the classroom, both on the school bus and then those teachers in general that will be teaching in the classroom?
David?
Transportation has definitely been one of the more challenging issues with going back to school. Some schools have done an block scheduling or an ABC scheduling where not all the students are going to school on a certain day. Some have off on a day or will be learning from home one day and learning in the classroom the next day. And this kind of gives the busing a little bit of they won't be to max capacity, and they'll be able to maintain that distancing. And schools are also doing a cleaning and disinfectioning of the school buses after each run, and maintaining that distance between the students and the bus driver. But we know that this is one of the more challenging aspects of the back to school, and there's not a good answer. The schools are doing as best as they can given their circumstances, but just pretty much do what you can, keep the bus clean, get creative, and use all the resources you can to keep the students safe.
Thank you. And Erie News Now, Ethan?
Hi, one final one for you, County Executive. You'd mentioned contact tracers and the importance of responding to them. How has the response rate been? Have you seen a decline there with people disobeying contact tracing, recommendations so that they quarantine? Are you seeing people ignoring calls from contact tracers, or is the response still fairly strong?
I believe the response is still fairly good, but there is a stigma, I guess, around this virus for some people. That's unfortunate because, again, it is a virus, it's an illness, and we need people to be honest and open with us. Sometimes people don't want to maybe reveal what they were doing because maybe they feel what they were doing was not following the guidelines, and maybe there's some embarrassment around that or some shame. But again, by not being honest, you don't help us control the virus. So we need them to be honest and open. When we call the individual who was a close contact, we don't reveal who the positive is, the name of the person. So that's a good thing. Sometimes people already know maybe, but we don't reveal that name to the people that we're calling. And so I think overall, I'd say we have had good compliance in Erie County to the quarantining that we have requested of individuals, and certainly of the isolation of those that are positive. For the most part, we've had very good compliance.
Thanks.
Mm-hmm. And Talk Erie, Joel, you have the last question?
Yes, ma'am. DCNR announced this week that Presque Isle, according to them, is experiencing overcrowding, and that they may have to take measures to reduce the number of visitors to the state park. Is there a county role in that? Are you encouraging Erie County citizens to stay away from the peninsula?
So we don't truly have a role. It is state property, and obviously much of this COVID guidelines and all that is driven by the state, and we would hope that they would monitor their own properties. And I think, again, like anything I say, I love the beach, right? We all do. We want to go there. But if I would go to a beach and feel uncomfortable there because it was way overcrowded, I'd find myself to another beach. We have over 7 miles of beaches, so there's lots of places we can go. And I think locally, we're probably much more familiar with the peninsula than those maybe who are coming from other places. So we can find those more secluded, less crowded places. And that's what I would suggest, that you move yourself to those places. Go on a weeknight after work instead of maybe on a Saturday or a Sunday, or go a little later in the day or earlier in the morning, times when it's not as crowded. And David, I'm going to turn over to you to see if you've had any contact, because I know sometimes you have contact directly through your environmental division.
I do know, I think there was some talks of closing one of the beaches, and that would limit one beach and make some of the others more crowded. But I haven't had direct talks with Presque Isle with regard to the overcrowding, but I agree with everything Kathy says. I like to go to the beach. I ride my bike down there. Just try to go to some of the areas that aren't as crowded, stay away from everyone. Less crowded times, evenings. But you are outdoors. Just if you wear a mask, keep your 6 feet of distance, and keep some hand sanitizer on you, I think it'll be okay.
Terrific. Thanks so much.
Thank you. So I think my last message about this COVID-19 as we finish up here is adaptability and contingency plans. As David said, the schools are having to adapt as they go forward. It's not easy. All of us as individuals and families and even business owners and such, we need to be adaptable, and we need to have contingency plans, because none of us know, what the next week, month, is going to bring us in terms of COVID-19, and that has been the case since it first arrived here in Erie County back in March. So think about those contingency plans and what you need to do for your family, for your students, and how you maybe can be helpful to somebody that either you're related to or live by to help them navigate through this, because there's many challenges ahead. I want to announce just a few other things about the census. You know, we're getting closer now. The census has been moved up to September 30th as being the last day. We now have a response rate of 71% of households in Erie County total. Within the county, 62% of the city total has come in. We're still a long way from reaching that 100%, which is obviously our ultimate goal. So please remember to respond at my2020census.gov or call 844-330-2020 to be counted. And now I'd like to mention two programs for our entrepreneurs in this community, particularly those who are thinking about starting a business. And I know that might sound crazy in this time of COVID, but it also might be a time to start planning for something you've always wanted to do. Erie County Public Library's Idea Lab is going to have two workshops for individuals who are interested in starting a business. One is called Get Started, and the other Co-Starters Core Cohort. Get Started is a 3-hour workshop covering strategies to start your business, and it's designed as a very low commitment way to kind of explore a business idea and help our future entrepreneurs with just sort of a much needed entry point. This workshop is free to those who register in advance, and you can find that on the Erie County Library page. The Co-Starters Core program is a more intensive 9-week program where students are led through exercises that will help them build their business from scratch. This program does have a small cost of $125. Again, you can register and learn more about these programs at erielibrary.org. So with that, I want to ask you all over this next week to try to stay as safe as possible, help our children get into school and stay in school, help our businesses stay open by wearing your mask, by washing your hands frequently, by keeping yourself 6 feet apart from people that you don't live with. And until we meet next week again, please stay as close to home as you can. Please stay safe throughout this time. And as always, please stay calm. Thank you.